Hi, my name is Michelle. I'm going to be your nurse today.
Hi, Michelle.
And what's your name?
Tony.
Oh, hi, Tony. How are you?
Good. How are you?
Today, do you mind if I do a complete head-to-toe physical assessment on you?
Go ahead.
Okay. First, what I'm going to do is inspect the skin, the arms, face, legs for temperature, hair distribution, texture of the skin, whether it's cool, moist, rough, dry. So first I'm going to do that. Can I see this on too? Just going to check the temperature, which is the same in both. And then I'm also going to check for skin turgor on both hands, which is normal, no dehydration. Okay, then I'm just going to check capillary refill. Good, and I would do that bilaterally, which is less than 3 seconds, which is normal. Then I'm going to check the lower extremities. I see this light too. Watch out, Candy. And I'm checking for edema, varicosities, hair distribution, which is normal for male pattern hair distribution. I'm also checking the feet too, which are a little cooler than the hands. And then I'm going to check capillary refill, which I would do on both bilaterally. Next, I'm going to palpate the head. I'm checking for any abnormalities, any lesions, any dryness, flakiness, hair distribution, any pain. Any pain when I touch there?
No.
There is slight alopecia noted. Hairs thin. No lesions noted at all. But while I'm here, I might as well just go ahead and palpate your lymph nodes. This is the posterior, sorry, my hands are cold. The posterior cervical chain, which is the back of the neck. The anterior cervical chain. And then deeper would be the deep cervical chain. In front of the ear is the preauricular. Back of the ear is the postauricular. Right under the mandible, I can't remember the name. This is, I can't remember, and then this is submental. I think this is mandibular. And then next I'm going to do your jaw, which I'm going to check for cranial nerve 5, which is trigeminal, which is jaw strength and as well as sensation. So what I'm going to do is touch your jaw right here. Can you open and close your mouth for me? Okay. All right. And no crepitus felt. Next, can you swing your jaw from side to side? All right. Can you jut it out forward? Okay. And can you go against my resistance? Oh, push your jaw forward against my resistance. Okay, good. Can you feel this?
Yeah.
Can you feel this?
Yes.
And what about this?
Yes.
On that side too?
Yes.
Okay, next, what I'm going to do is check your eyes. Do you mind taking your glasses off for me? So first I'm checking, I'm also going to inspect the face for symmetry. The eyes are sitting on the same side of the face. The nose is midline. Lips are midline. And the ears are even with the outer canthus of the eye. Next I'm checking the eyebrows, checking for hair distribution, which is even on both eyebrows. Next, what I'm going to do is palpate the lacrimal sac, which is the inner canthus. So I'm just going to touch. Can you close your eyes for me? Any pain when I touch there? No. Any pain around here? Okay, good. You can open. And I'm also checking eyelashes too. Eyelashes seem to be the same bilaterally. Then I'm going to check the sclera, which is white, not yellow. Then I'm checking. Next, I would check the pupil, which I'm going to check with the pen light, with the ophthalmoscope actually. Then I'm going to check the conjunctiva. I'm just going to pull your lower eyelids down, okay? All right, which is nice and slightly pink. No abnormality.
That's good.
Okay. So next I'm going to check your eyes here. Actually, let me do a couple of tests first. So first I'm going to check to see if your pupils are reactive to light. What I'm going to do is shine a light in your eye, and I'm going to check to see if it constricts. If it constricts, then that's normal. Okay. Can you look straight at me? Good. The other one. Good. All right. Next, what I'm going to have you do is follow my ophthalmoscope. Okay. Don't move your head, just move with your eyes. Okay. You okay?
Yeah.
Next, what I'm going to have you do, I'm going to try and stand in front of you as best I can. Actually, can you look this way? Sorry.
No, it's fine.
Do you mind looking at, let's see, can you look at the Barbies right there? And then what I want you to do, when I tell you to, look at my ophthalmoscope, okay? Look at my ophthalmoscope? Okay, good. And then I'm going to come forward, follow my ophthalmoscope. Okay. That was confrontation, which was normal. I was looking for pupil constriction from far away to near, and then making sure the eyes weren't, sorry, I know.
No, it's okay.
Then making sure the eyes weren't kind of almost like tremor-like when I put the ophthalmoscope towards the nose. So next what I'm going to do is the cover-uncover test. What I'm going to have you do is, actually I can do this, I'm sorry. So I'm going to cover one of your eyes, and I'm going to tell you to look to your left, and then I'm going to uncover it and make sure that there's no movement in the other eye, in our eye that was covered, okay? All right, can you look to your left? All right, and then we would do that bilaterally. Next, I'm going to look in the inner eye. And let's see, I don't want you to look straight at me because I don't want to blind you. Let's see. Can you look at me with your right eye? Okay, good. And by looking inside the eye, what I'm looking for is the optic disc, the macula. There's another one I'm looking for too, but I can't remember the name of it. And checking the artery and vein ratio, which is 3:2. Then there's no blood noted in the back of the eye, which is normal. Next, what I'm going to do is check for the, I can't remember the name, the term, but you shine the light at the bridge of the nose and you check to make sure that it's shining in both eyes. If it's not, then there's an abnormality. So I'm just going to take this, I'm going to shine. A little smaller. I'm going to shine this right here. I see a twinkle in both eyes. Alright, what am I going to do next? Oh, and by doing those eye movements, the cranial nerves that I was testing were cranial nerve 3, 4, and 6. 3 is oculomotor. 4 is trochlear, and 6 is abducens, which is extraocular eye movement. I will test the cranial nerve 2 optic nerve, which would be by the Snellen chart or the, I think it's called the Rosenbaum. I can't remember. That one tests for near vision, which would be 14 out of 14. And the Snellen chart tests for distance vision, which normal would be 20 out of 20. Let's see. I'm going to check up your nose. Okay. I'm checking for hair distribution. I'm checking for the sinus cavities. There was some noted one that's further back that I cannot see. There is hair distribution in both. No septum deviation. Can you cover one nostril, blow out? And in? Okay, next one. Okay, good. No trouble breathing at all? Okay, good. Next, what I'm going to have you do is smell 2 different scents for me. Okay? So what I want you to do is cover one of your nostrils, close your eyes, and I'm going to have you smell something and tell me what it is, okay?
Okay. It's candle. Vanilla.
Yep.
Yeah.
Okay. And next, go ahead and do the other nostril.
Smells good. It's gotta be like lotion.
Yep. Okay. And that was testing cranial nerve 1, which is olfactory.
That was a strong smell.
Okay, next I'm going to look in your ears. First, let's go ahead and test cranial nerve 8, which is acoustic. So what I'm going to do is have you cover one ear. I'm going to whisper in this ear, and you tell me what I said.
Okay. My name is Michelle.
Next ear.
Candy.
Yep. Good. Okay. So, what I'm going to do first, I'm going to check the outside of the ear, checking for any growths, any abnormalities, any pain there at all. I do not see any discharge coming from the ears. I would do that bilaterally. Next, I'm going to go ahead and check in the ear. And I'll do this ear so that you can see. Okay, and I'm checking for the tympanic membrane. I'm checking for hair distribution, any discharge. Checking for internal structures, the malleus. And the tympanic membrane is intact, no bulging. There's no cerumen noted, and the tympanic membrane is slightly opaque color, like a grayish white, which is normal. Next, I'm going to do the Weber and the Rene test, which is also tests for hearing as well. By doing this test, what I'm going to do is strike the tuning fork. I'm going to put it on top of your head, and you let me know if you hear the vibration or hear the sound in both ears, or one or the other, okay? Or nothing at all.
Both.
Okay, good. Next, I'm going to do the Rene. I'm going to strike the tuning fork again. I'm going to put it on the bone behind your ear. Tell me when you stop feeling the vibration, and then I'm going to put it in front of your ear and tell me when you stop hearing the sound. And I would do that bilaterally. And we want air conduction to be twice as long as bone conduction.
I hear it.
You mean feel it?
I don't feel it yet. I feel it.
Let me know when you stop hearing it.
Okay. Yep. I'm done.
Okay, good. Let's see. Next, I'm going to, let me test facial nerve number 7. Cranial nerve number 7, which is the facial. If you just smiled, so you just showed me that that cranial nerve is intact. Can you puff out your cheeks? Put your tongue in your cheek. Okay, good. you shrug your shoulders? Okay, that's cranial nerve 11. Next, I'm going to look in your mouth, if you don't mind. I'm going to check the lips. I'm going to check for, if, dryness, chapped, but the lips are pink and moist. Okay, can you go ahead and open up for me? Stick your tongue out. Go back and forth. All right, open your mouth wider, please, so I can see the back of your mouth. Okay, I'm checking for the frenulum, which is intact. I'm checking for teeth. I'm checking for dryness, moist, make sure there's no dehydration. Can you stick your tongue out and say ah? Okay, and I'm checking the hard palate to the soft palate. I'm checking for the uvula to rise and fall. The patient saying ah tests cranial nerves 9 and 10, which is glossopharyngeal and vagus, which is the gag reflex and swallowing. And by moving his tongue back and forth, that checks for hypoglossal, which is cranial nerve 12. Yeah, cranial nerve 12. All right, what am I going to do next? You okay?
Yeah.
All right. Next, I'm going to move on to the thorax and the abdomen. So what I'm going to do, I'm going to check for the anterior and posterior diameter of the chest. The chest is positive for respirations, slight pulsations. Oh, there are two things that I forgot to do. I need to check the trachea, I need to check the thyroid, and I need to auscultate the thyroid and auscultate the carotids. If you don't mind, can you look that way for me? I'm going to palpate the carotid, and I'm going to do that bilaterally, not both at the same time. I do not see any jugular vein distension, but the carotids are positive for pulsations, which is normal, as long as there's no distension. Can you look up for me? Can you swallow? Okay. Trachea is midline. Let's see. I'm going to feel for your thyroid. Can you put your chin up a little bit and swallow? Okay, good. No nodules were felt. You all right, sir?
Yeah.
Okay. So next, I'm going to check the thyroid and the carotids. So I'm checking for bruits. And in the thyroid, if there was a bruit, that would mean that it was enlarged. And I'm checking with the bell. Okay, and can you look towards me? Checking the carotid. Okay, and I would do that bilaterally. No bruits were heard. Are you sure you're okay?
Yeah, I'm just
Itchy?
no.
Sensitive?
Yeah, I'm ticklish in my neck.
Okay. I did that. All right, almost forgot about that. Sorry, sir. Check in your thyroid. All right. So next I'm going to check the thorax and the abdomen. And I'm just going to palpate here. Any pain? Okay. I'm palpating for any masses, any tenderness, and I'm also checking for pulsations, any heaves, anything that would stand out as being an abnormality. I'm also checking, ideally I would have the patient's shirt off, and I'd be inspecting the skin as well for any abnormalities, any freckles, and noting any in the specific areas, and if anything is new or it's been there for a while. Next, what I'm going to do is, I think I'm going to have you face that way. No, your body that way.
Oh.
Yeah, no, keep the chair like this.
Keep the chair like
yeah.
this.
because what I need to do next is do the tactile firmitis.
Okay.
Can you say, when I put my hands like this, say 99?
Okay.
Say 99?
99, 99.
Okay, good. Tactile firmitis is normal. Vibrations felt bilaterally. Next, I'm going to have you take in a deep breath. And out. One more time. Okay, and I'm checking thoracic expansion. Next, I'm going to percuss over the lungs, and I should hear resonance. Okay, that was normal. Next, I'm going to percuss for the thoracic diaphragmatic excursion. I can't remember exactly how it's termed. Okay. So I'm going to have you do is lean forward. I'm going to pull your shirt up just a little bit, okay? Because I need to do a couple of pen marks here. What I'm going to have you do, can you cross your arms a little bit? I'm going to have you take in a deep breath and hold it, and I'll tell you when to breathe out. Deep breath. Okay, breathe. Now I'm going to have you take in a deep breath, let it out, and hold your exhale. Okay, breathe. I'm going to measure that, and it should be between 3 and 5 centimeters. And yours is at 4.5, which is normal. All right, so you can go ahead and sit up. Shoot, now I'm breaking my tape measure. Okay. Next, what I'm going to do is listen to your lungs. And just breathe normally, okay? Actually, do you think you could face your back towards the camera just a little bit?
Like sit that way?
Actually, you know what? Yeah, sit that way, if you don't mind.
No problem.
Okay, very good. Now I'm going to listen to your lungs the other way. Can you put your arms up over your head and rest them on your head? Okay, you can put them down. Okay, very good. Next, I'm going to feel for your pulses. I'm going to do brachial bilaterally, radial bilaterally, popliteal bilaterally behind the knee, posterior tibial, and dorsalis pedis on the foot. And I would check those both bilaterally. Next, I'm going to listen to heart sounds. I forgot to do something earlier. Can you go like this with your fingers for me? And I'm checking for the angle in between. Okay, good. All right. heart. Second intercostal. Second intercostal, right midclavicular is aortic, and S2 would be heard louder here. Second intercostal, left midclavicular is pulmonic, and S2 would be heard louder here. Third intercostal, left midclavicular is Erb's point, and S1 and S2 would be heard the same here. Fourth intercostal, left midclavicular is tricuspid, and S1 would be heard louder here. And finally, the PMI, which is the fifth intercostal left midclavicular, or the mitral, or the mitral, S1 would be heard louder here, and this is where you would get your apical heart rate, then you would listen for a full minute. And I'm also going to palpate for the PMI, which is easily palpable. Good. Before I have you lay on the bed and I do your abdomen, things like that, what I'm going to have you do is some range of motion things. And I'm also going to do some reflexes and tests for sensation. Okay. Can you stand for me? And let me make sure the thing's still recording. Okay, good. Still recording. All right. Can you put your...
I'm gonna step back a little bit.
No, you're good.
Okay.
Can you put your chin towards your chest? Straight up. Head back. Okay. And can you go this way? And this way? Alright, and can you go in a circle? Okay, good. Can you put your head back against my resistance? And forward. And sideways. Sideways. Okay, and turn against my resistance. It's okay. Okay, good. Let's see, what else do I want you to do? Put your arms out for me. In this way. And can you put them away from your body and across? Okay, put them back out. Put them like this. Can you bend your elbows? Straighten them. Okay, and do that against my resistance. Put your arms out. Try and bend your elbows. Okay, and try and put your arms down. Okay. Keep your arms up again. And put them like this time. Sorry. Okay. Push me away. Push me in. Let's see. Okay, now put your arms back up. Can you put your hands like this and down and straight? And can you bend your fingers? Straighten them and bend them like this. Okay, good. While I'm on your fingers, actually, let me have you do your hands against resistance. Keep your hands out straight. Sorry. I'm gonna have you push your hands up against my resistance. All right, down. Squeeze my fingers. Okay, good. Next, while I'm at your hands, so I don't forget, I'm gonna check like positional to see if you can recognize what position your extremity is in. So what I want you to do, I should have you do this sitting down, but so I don't forget. This is neutral, this is up, and this is down. I'm going to have you close your eyes and tell me what position it's in.
Neutral. Down. Up.
Okay. Good. Oh, can you put your wrist in a circle? Good. Let's see. Can you stand with your feet shoulder width apart? Close your eyes. No, you exaggerated that one. Okay, and then put your arms straight out. Close your eyes and touch your pointer finger to your nose with one hand.
Which hand?
Whichever one you want. Put it back. Other one. Okay, good. Put it back. All right. Can you, with your torso, without moving the rest of your body, go like this? Okay. Can you bend back? Okay, and bend forward for me. Nope, more. I need to check your spine.
Oh, turn around so they can see.
Yeah. And I'm going to check your spine for scoliosis. Okay, very good. And checking the muscles back here too. All right. What am I doing next? Your hips. Can you take one foot and go like this? One leg and go across? And what about the other one? Go across. All right, and can you put your leg out forward? Put your leg back. Okay. Now what I want you to do is stand a little further away. Walk towards me, heel to toe.
Doing a sobriety test?
Mm-hmm. All right, good. Now you can sit down. Since I'm here, can you, with your feet, can you point your foot down? Both feet, like point it, like this. Like a ballerina, yeah. And then point it up. All right. And then don't like his feet, Candy. Push your feet down like you're pressing on the brake pedal. Push your feet up. Next, what I'm going to do, I'm going to write a number in your hand, and you're going to tell me what number it is.
All right. Do you mind if I get my glasses back?
Oh, I'm sorry.
It's okay. Just being blind this whole time.
Oh. Close your eyes.
Sorry, you can do it again. 7.
Good. Next, I'm going to hand you an object. Keep your eyes closed. I'm going to hand you an object, and you tell me what it is, okay?
Okay. It's a tape dispenser thingy.
Mm-hmm. Good. I couldn't use the coin because you saw it already.
Oh.
Okay, you can open your eyes. Next, I'm going to test sensation. This is rough. This is smooth. And this is sharp. Okay. Or dull and sharp, I'm sorry. That's what I should say. So I'm going to have you close your eyes. And I'm going to do that, okay?
This is dull. Sharp. Dull. Sharp.
Okay. And I would do that bilaterally. Next, I'm going to do your reflexes. Oh, when you lay down, I'll scan the room. All right. So, can you face that way?
Oops, sorry.
Thank you. Okay. So I'm gonna do the tricep. No. Okay. All right. Relax your arm. Rest your arm. Okay. And the brachioradialis. Did you really? I'll do the popliteal and the ankle reflex when we sit on the bed.
I can sit up on that bed, on that thing if you want.
On the table?
Yeah, if you want.
It's almost halfway broken.
Oh. I'll finish breaking it.
Shoot, I think I'm doing pretty good. Okay, let's go sit on the bed. I'll do your knee and your ankle, and I'll scan the room. Let's put it right here for now. For now, let's do these two. Candy, move, honey. Move. Okay. Now I'm going to have you lay down.
This feels good.
Does it? I want to lay down. Okay. First, what I'm going to do is I'm going to have you do the rest of the exercises with your hips. Can you, actually let's do your knees first. Can you bend your knee? Bring it towards your chest. And do the other one. Okay, put it down. Put it down. Bend your knee and bring this knee towards this knee. All right, do the other one. I know it's hard. Okay, put it down. What did I do the rest of your... Why are you laughing at me?
No.
Okay, I think that's good. Why are you laughing?
I'm not laughing.
You are laughing. Okay. Do you mind if I pull your shirt back a
Go
little
for
bit?
it.
Okay. Alright. Just right there. Okay. So, what we're doing first is inspection. The abdomen is positive for hair, which is common with male hair pattern distribution, positive for respirations, and positive for pulsations, which is normal. The belly button is inverted. Oh, I forgot to do something with your, I forgot to do two things. Can we do them really quick?
Sure.
Okay. So I forgot to, I need you to take your heel and put it down your shin, and then do these really fast movements on
right now, or you want me to stand up?
You can do it there, yeah.
Oh.
All right. And the other one.
Are you sure I don't need to stand up for this?
Hmm?
I don't need to stand up?
Yeah, stand up. Stand up. Okay, I would have you stand.
Okay.
And then I would have you do this really fast on your lap. You can do that both ways. I would ideally have you stand for that. Okay, now I'm gonna just back up.
Now you're gonna expose me.
So I'm gonna do inspection. This is gonna be different than other assessments. You're gonna inspect and auscultate first before palpating. So I did an inspection at And let's see. Okay. I'm gonna listen. It's gonna be kind of cold.
It's okay.
Okay. I guess I should do this. Well, you're definitely active, that's for sure. So vowel sounds were normal active. I would listen for a total of 5 minutes if I didn't hear any vowel sounds, and normal is between 5 and 35. So nothing. So next I'm going to percuss. Yeah. And I'm going to hear timpani. Which is normal. And then I'm going to percuss for the liver.
They said it sounded funny.
Oh. So it's going to be resonance, no, timpani to dull, and resonance to dull. Sorry, I have to write on you. Alright, and anywhere between 6 to 12 is normal, and this is 9.5. What was mine? 8 something? Okay.
What are you measuring?
The liver.
Oh, that's a big liver.
Okay. And then I'm going to percuss for the spleen. Sorry. Oh, I forgot to listen to the arteries. I'm going to listen with the bell of my stethoscope. The renals. Iliac. And I'm going to defer the femoral. Dang it, I can't believe I forgot to do that. Okay. So then I'm going to percuss for the spleen. I'm going to percuss around the can't think of the name of it. Sternal border? No. I can't think of the name of it right now. But I'm going to palpate around this area, which is on this side would be right here. And around the margin, I'm going to hear timpani, which is normal. Within the margin, I should hear resonance or dullness, but no resonance or dullness outside of the margin. Which is normal, and that means that the spleen is tucked up under the rib cage, and I would not be able to feel it unless it's enlarged. Next, I'm going to palpate. Yeah. Next, I'm going to palpate. Any pain there? Pain. Any pain? Any pain? Okay. And I'm going to palpate the liver. What I'm going to have you do is take in a deep breath for me, and then cough, okay? Cough. Okay, good. Sorry, I know that probably hurts, huh? Okay. And the liver was smooth without nodules, and it was very easily palpable. Next, I'm going to palpate the kidneys. Don't move. You don't have to move. I'm going to palpate the belly button. No herniations felt. Any pain?
No.
Okay. Let me see if I forgot anything. Your feet. Can you take your toes and point them towards your left foot?
Like this?
Your right toes and point them towards your left foot. In? No, in. In. Yeah. And then out. Okay, same with the other one. Okay. And your hands. I forgot to do one thing with your hands. Keep your hands straight. A little further apart so that you don't. No. Okay. And keep your arms straight. Move your hands and go like this and like that. Okay, good. Check your eyes. Check the inner eye. Check your ears. Nose, mouth. Check the cranial nerves. I think I'm done. That's a wrap.